GLP1s and bone density. Here's what we know so far, no fear-mongering included. I'm Dr. Alta Peter, board certified in obesity medicine, and I wanted to talk about this topic because I have seen an alarming number of scary posts in my feed, even on LinkedIn, all over the place, with scary images and fear-mongering messages trying to deter people from taking these medications for the purpose of weight loss. So here's what we know so far. There are a lot of studies on this topic, and the results honestly are sort of mixed. In general, people who are taking this medication specifically for the management of type 2 diabetes, at the doses that are used for diabetes management, numerous studies have shown that the effect on bone is neutral to actually protective. So that's good news. The concerns come in when we're using the higher doses of the medications, specifically for the treatment of obesity. But before we jump to just blame the medication, it's important to understand what we already know about weight loss and bone health. We've known for a long time that significant weight loss, whether that is from a strict calorie-restricted diet or even an intervention like metabolic bariatric surgery, we know that significant weight loss is associated with a reduction in bone density. So it is something to have in mind and pay attention to. But that doesn't mean that worsening bone health is a foregone conclusion if you're taking a GLP-1. In patients using a GLP-1 specifically for weight loss, one of the most compelling studies showed that when you combine the medication with a structured exercise program that focuses on resistance training, you can maintain bone health while effectively losing weight. That study was done with liraglutide, which was actually the first GLP-1 approved specifically for the indication of chronic weight management, and it's been around and available for a long time. So in that study, what they did was all of the participants were placed on a strict low-calorie diet. It was very low-calorie, 800 calories per day, medically supervised diet for 8 weeks. Everybody lost weight. And then they randomized the participants to one of 4 groups. So a placebo group, a liraglutide alone group, exercise-only alone group, and then the combination of the medication plus exercise. And that combination group had the greatest weight loss after 52 weeks and also maintained their bone mineral density, same as the patients who were on placebo. So this wasn't a huge study. It was 195 participants, but it's really encouraging. It suggests that with careful attention to bone density, close monitoring, adequate nutrition, and the incorporation of resistance training from the beginning, patients can successfully lose weight while maintaining bone health. So if you have more questions about this topic, I would love to address them. You can leave them for me in the comments below. Thanks.